Vital Signs and Monitoring Devices, Chapter 13. Some of the things we're going to be talking about today are how to gather the vital signs and what the vital signs actually mean. So how do we gather vital signs? The importance of vital signs it shows the outward signs of what is going on inside of the body, and it helps us identify important conditions or trends in the patient condition. So these are gathered on virtually every EMS patient and multiple times during the encounter. Patient severity and treatment priorities may prevent acquiring vital signs or delaying the acquisition of vital signs. So what are vital signs? We're looking for pulse, respiration. We want to know their skin color, temperature, their condition, capillary refill in infants and children. We want to know what their pupils look like, and we want to know their blood pressure. So your baseline vital signs is the first set of vital signs that you obtain. And then when you repeat your vital signs, you'll gain further information by establishing trends in the differences between your patient's vital signs. So pulse. A pulse is a palpable pressure of the heart beating, and it causes blood to move through the arteries in waves. This can be felt by placing a fingertip over an artery where it lies close to a body surface and it crosses over a bone. Here you see the pulse being taken at the radial artery, and it's over the radius. So that's why when you palpate it over a bone, you're able to feel the pulse at your wrist. The pulse rate is the number of beats per minute, and a normal resting rate for adults is in between 60 and 100 beats per minute. Tachycardia is a rate above 100 beats per minute, and bradycardia is considered slow, which is a rate below 60 beats per minute. Pulse rates above 120 beats or below 50 beats per minute is considered a serious finding. And during an emergency, it's not unusual for a pulse rate to temporarily be between 100 and 140 beats, depending on what's going on. So what normal situations might account for a heart rate outside of the normal range? Pulse quality. There's a couple different factors that we use to determine pulse quality. We want to know about the rhythm. This reflects its regularity. Regular when intervals between beats are consistent, and it's irregular when intervals are not consistent. Force. This is the pressure of the pulse wave as it expands in the artery. Pulse should feel strong. Thready is when a pulse feels weak and thin. Common pulse locations are going to be the radial artery. This is used in patients 1 year and older, also known as the wrist pulse. This is found by placing the first 3 fingers on the thumb side of the patient's wrist just above the crease. You want to assess your respirations for rate and quality after you've checked your pulse. You can do this a couple different ways. You can count for 30 seconds and multiply by 2, or you can count by 15 seconds and multiply by 4, but you don't really want to divide it down any further than that. You can use the brachial artery. This is used in patients 1 year of age or younger. This is your upper arm pulse. It's basically going to be just under the bicep where that would be. So it's going to be against the humerus just under the bicep. The carotid. This is felt along the large carotid artery on either side of the neck. Like I said earlier, you can count your pulsations for 30 seconds and multiply by 2. If it's not consistent or you're not sure what's going on, you can continue to count for the full 60 seconds. Just judge the rhythm and the force. With regard to vital signs, respiration means the act of breathing in and out. This measurement is going to include both the rate and the quality. The respiratory rate is going to be the number of breaths the patient takes in 1 minute. So the rate of respiration is going to be classified as normal, rapid, or slow. The normal rate for adults at rest is going to be between 12 and 20 breaths per minute. Age, sex, size of the patient, physical conditioning, emotional state will all influence your breathing rates. Any rates above 24 breaths per minute, which is considered to be rapid, or below 8 breaths per minute, which is considered to be slow, are potentially serious findings. Respiratory quality, we're looking at 4 different categories here. Is it normal? Is it shallow? Is it labored? Or is it noisy? You want to count respirations after assessing the pulse rate. You can count the number of breaths taken over 30 seconds and multiply by 2. Note the rate, the quality, and rhythm of the respirations. For skin condition, we want to know the color, the temperature, and the overall condition of the skin. This can provide valuable information as it relates to circulation. The best places to assess skin color is going to be the nail beds, the inside of the cheek, or the inside of the lower eyelids. Abnormal skin colors are going to be pale, cyanotic or a blue-gray color, flush or a red color, and jaundiced or a yellow color. For temperature, feel the patient's skin with the back of your hand. If the skin feels warm, hot, cold, or cool. For children under 6, also evaluate their capillary refill. Press on a nail bed or the top of their hand or foot and release. Take a look to see how long it takes normal pink color to return. Normal is less than 2 seconds. The pupils are the black center of the eye. So in a dim environment, the pupil will dilate to let more light in, and in a bright environment, the pupil will constrict to try to keep some of that light out. When you're assessing the pupils, note the baseline size. Then cover one eye and shine a light into the other eye, and repeat with the opposite eye. What we're looking for is size, equality, and reactivity. Here you can see at the top, we've got constricted pupils. Here in the middle, we've got dilated pupils. And on the bottom, we've got unequal pupils. Unequal pupils can be a sign of somebody under the influence of some sort of topical drug that's placed onto the eye, or it can also be signs of a head injury. Blood pressure is the force of blood against the walls of the blood vessels. For normal blood pressures, you expect to see a systolic no greater than 120 millimeters of mercury, and a diastolic no greater than 80 millimeters of mercury. Any change can indicate something very significant. Blood pressure is measured with a sphygmomanometer and a stethoscope. Cuff should cover 2/3 of the upper arm in the area of the elbow to shoulder. You'll wrap the cuff around the patient's upper arm. The lower edge of the cuff should be placed about 1 inch above the crease of the elbow, and the center of the bladder placed over the brachial artery. So in order to get a blood pressure by auscultation, prepare the patient. You'll position the cuff and the stethoscope in place. Palpate the brachial artery at the crease of the elbow. Position the stethoscope and position the diaphragm of the stethoscope directly over the brachial pulse or the medial anterior elbow. Inflate the cuff. You'll listen and inflate until the gauge reads 30 millimeters higher than the point that the pulse sound disappeared. Obtain your systolic blood pressure by slowly releasing the air from the cuff. When you hear the first of these sounds returning, note the reading on the gauge. Continue to deflate the cuff. When the sounds turn to a dull, muffled thuds, the reading on the gauge is the diastolic pressure. Then record your measurements. To determine a blood pressure by palpation, you'll position the cuff and find the radial pulse. Inflate the cuff and obtain and record the systolic pressure. Then slowly deflate the cuff. Note reading when the radial pulse returns. That's going to be the systolic pressure. Blood pressures are difficult to obtain on infants and children younger than 3 years. So in most cases, we do not attempt a blood pressure under the age of 3. The most useful information you're going to retrieve about the condition of an infant or a young child is really going to be from your observations. So look at their conditions and look at their observations to determine whether they're sick, whether they appear to have respiratory distress, or if they're unconscious. If you're going to use a monitor to determine a blood pressure, position the cuff and inflate the cuff. Obtain and record the systolic blood pressure, and then slowly deflate the cuff. For temperature, a narrow range of temperature allows chemical reactions and other activities to take place inside the body. The core temperature reflects the level of heat inside the trunk. Normal temperature is going to depend on the time of the day, their activity level, their age, and where you obtain the temperature reading from. Measurement of proportion of oxygen attached to hemoglobin is what oxygen saturation is. This is measured with a pulse oximeter. So when do we want to use a pulse oximeter? The protocol depends on the institution. Some places use it on every patient, other places do not. Generally includes all patients complaining of any sort of respiratory problems or who is otherwise at risk for hypoxia. Remember that a reading above 96% does not necessarily mean that you should withhold oxygen from a patient who is having signs and symptoms that indicate the need for oxygen. Normal pulse oximeter readings are between 96 to 100%. If a patient is experiencing mild hypoxia, you can expect to see their pulse ox readings in the 91 to 95% range. Once they get into significant or moderate hypoxia, you may see those fall into the 86 to 90% range. And severe hypoxia is going to be patients presenting with a percentage of pulse ox of 85% or less. Remember that the accuracy of the reading can be affected by lots of different things, so treat your patient and not necessarily the monitor. Just because it's reading low doesn't necessarily mean that it's an accurate reading. If they're in shock or experiencing hypothermia, it can read low or altered. Carbon monoxide will typically make it read very high when in fact their oxygen saturation levels are low. Certain other uncommon types of poisoning will cause it to read at an error. Any sort of excessive movement, nail polish, or anemia can also skew your results. Blood glucose. This measures the quantity of glucose in the bloodstream, and it can help identify some diabetic emergencies. Here's a picture of the glucometer, along with the test strips and the lancets. To use a blood glucose meter, some areas require permission from medical direction or by local protocol. In our system, we follow local protocol, so you don't need immediate consultation or permission from medical direction. Monitors, remember, must be calibrated and stored according to the manufacturer's recommendations in order for them to read correctly. To use it, you want to prepare the device, the test strip, and the lancet. You'll clean the patient's finger with the alcohol swab, and you'll perform a finger stick with the lancet. Apply blood to the test strip, and use the glucose meter to analyze the sample and provide a reading. Normal levels, we would like to see them at least 60 to 80 milligrams per deciliter. We don't want to see them any more than 120 or 140 milligrams per deciliter. Remember that infants and children have a faster pulse and respiratory rates and lower blood pressures than adults. So age is one of the most important factors in determining what the normal range would be. Remember, you can gain a great deal of information about a patient's condition by taking a complete set of baseline vital signs, which includes your pulse, your respirations, skin condition, pupils, and a blood pressure. The EMT must become familiar with normal ranges for pulse, respirations, and blood pressure in adults and children. Trends in patient condition will become apparent only when vital signs are repeated, which is an important step in continuing the assessment. How often you repeat the vital signs will depend on a patient's condition. At least every 15 minutes for stable patients, and at least every 5 minutes for unstable patients. Remember to consider if there is time to obtain vital signs or if you must wait to obtain them while en route to the hospital. And consider when you should apply a pulse oximeter. Should you apply it to a patient with difficulty breathing? Should you apply it to a patient without difficulty breathing? Consider whether abnormal vital signs are a result of an illness or injury or the result of some other external factor. Questions to consider. What are the vital signs? What do we need to obtain? Explain why vital signs should be taken more than once. How much time should the EMT spend looking for a pulse when the radial artery pulse is absent or extremely weak? How should you react when the blood pressure monitor gives you a reading that is extremely different from previous readings? How can you get an accurate pulse oximeter reading on a patient with thick artificial nails? Sometimes a patient's heart will have an electrical problem and beat more than 200 times a minute. Why is the pulse so weak in such a patient?